very good evening to all of you. I'm Sayukta from Beautiful Spotless Skin team, and I would like to welcome you all to this very Insta live session. So the topic in which we all are going to, delve into is acne management. And 85% of young adolescents or teenagers go through this issue of acne vulgaris, and I'm sure you, as a teenager, has also faced that. It's a very natural process, but then it's important to understand how to prevent it, how to take care of it, how to maintain a healthy skin barrier, and especially for those who have a oily skin, or we see a lot of cases of adult acne also these days. So, how to take care of our skin, what to do, what not to do, is going to be our topic of this conversation. On the subject, we'll have with us Dr. Radha from Hyderabad. She is an experienced cosmetic dermatologist with 7 years of experience. She holds an MD in dermatology from Dr. NGR University 2017 and an MBBS from Osmania Medical College in 2013. A member of IEDBL and ACSI, she has treated over 20,000 plus patients and performed 3,000 plus surgeries. Known for her friendly and caring nature, Dr. Radha ensures a comforting experience for every patient. Her work has significantly raised dermatological awareness, impacting hundreds of families. She remains dedicated to providing effective and compassionate care. Today, we are going to be joined by Dr. Radha soon. Now, the thing is, with skin, now skin is the largest organ of our body, and does do expect and have some expectation from us as well. They need some kind of respect, no abuse. But then we are so lenient with skin. Many a times we do a lot of experiments in terms of home remedies, etc. Here we go. We have with us Dr. Radha from Hyderabad. A very warm welcome to you, Dr. Radha.
Hi, hi. Am I audible?
It's yes, absolutely, loud and clear. It's such a pleasure to have you with us because the topic of today's is acne management, and acne is such a common and chronic skin condition, and almost all of us has gone through that phase of acne vulgaris. So it becomes even more important to understand from a proper skin expert like you to what to do, what not to do, etc. To start with, doctor, what is acne? Why it is formed?
Okay. See, uh, acne is one of the condition which we encounter. Usually, now it has been, there is no age group limit to it, because we are seeing it commonly in the teenage, also in the middle age, and also in the adult life. Okay, it is a problem involving the oil glands, where you have, there will be a small keratin block which happens in the in the pilosebaceous unit, where the oil gland is supposed to drain its content out. There will be a small blockade, and then it will lead to further, like a small comedone, a small papule, and then a small pustule, and sometimes it will lead to bigger nodules also. So it is a spectrum of a disease where we have to address each and every stage separately.
Right. Now, doctor, many times we see a lot of various types or grades maybe of acne. For as a layman, we see those blackheads or whiteheads. Then it turns out to be really big and painful and pustule, and many a times it looks like a cyst or nodule. So, what are the various grades of acne, doctor?
Okay, clinically, broadly, we can put it into 4 grades. Okay, where stage one, initial blockade, which I spoke about. It can be an open blockade, which we can see from outside, that is called as an open comedone, or it can be covered with a small layer of skin called as a closed comedone. Okay, or you can say comedone, whitehead is a closed. Okay, in so that is the stage one of acne. Then what happens is, once there is a blockade, the oil secretion inside the gland is going to get accumulated, and it will lead to a small bump. So that is called as a papule in medical term, and that is like a grade 2 acne. Okay, and in the later stages where you have your bacterial overgrowth happens, and it slowly forms into a pustule, that is called as stage 3 acne. and slowly even our body tries to contract this, it tries to heal, so all our white blood cells pool in. Sometimes the oil gland even ruptures inside the skin, and then it forms into a small cystic or a nodule type. This is called as, this is like a stage 4 acne. So this nodular or cystic acne, they are considered as a little, higher stages of acne, and we need to address them. Okay. Also, the sequelae of acne are to be addressed. So basically, 4 stages, as I told you. Okay. Hello. Yeah. I'm not able to hear you.
Yeah. Yes. So, doctor, my question is, the earlier we go to see a doctor, in the initial stages, is it a good idea? Because, what we as laymen understand is the bigger the acne is, there are more chances of getting those post-acne scars and marks. Is it right?
No, it is not right, because earlier there was a notion that only, see, these teenage acne are going to just come and go. Okay, people used to
Mhm.
think, and even now some of the parents are reluctant to bring their teenage to the doctor, because they are like, we all had this phase, they are going to come, they're going to go. But it is not, only the end stage or grade 4 acne which lead to scar. Even the starting, the comedones also can lead to scars. Typically, those
Yes. Mm.
stubborn scarring can happen. And you know how important now it is for us to be or have a good skin, because scars, they are going to add, that trauma to the patient for a very long time, even though we drew a lot of lasers in the future also. So it's always better to start or initiate the treatment in the early stages only. And especially for kids who are having a family history of scarring, like one of the parent is also a scarer. So for them, it's always better to treat them, a little aggressively also.
Right. So the right way is to go and see a doctor, a dermatologist, as soon as you spot an acne on your face. Don't wait for it to, grow. As Dr. Radha has very well said, that acne, comes and goes, but then the scars are like forever, and it becomes such a bigger challenge to deal with those scars and marks. So even, we would like to request the parents, because as teenagers or young adolescents, they first go to their parents, and then parents, go and consult a doctor or take their kid there. But it's important to understand that even if you think that it is a natural process, yes, it is. But then please don't wait. Get it checked. Fever is also a very natural process of our body to, combat the and fight with the bad bacteria. But then we go and get it checked with the doctor, right? So do the same with acne also. Now, doctor, we often get to hear so much about skincare and how important it is, and how important it is to maintain a good skincare regimen so that our skin can have a good, healthy barrier to deal with, whatever is there. So, I would like to ask you that what kind of a basic, a minimalistic skincare routine we can go and adopt, so especially for these acne.
No, with all this awareness or this Instagram things going on, basically, I know skin care importance has been penetrated well into the society, but we always have to remember that, regarding skin care, less is more. Okay, so it's not like what online, whatever you see over the counter in the Nykaa or in the Instagram, you just keep buying it and applying it on your. So there are now the, even if we see the patient's trend also, the cases where people have tried a multiple options and then having breakouts have become more. Okay, so the awareness is doing bad also equally, apart from the good.
Mm.
So always
True.
one body is less is more. So what are the basic requirements of skin you should understand? What is the type of your skin? So if you have a dry skin, you have to use a moisturizer. If you have an oily skin, you should try and use a lightweight moisturizer which is not clogging your pores. So if you understand the basic needs of your skin, and if you have an in a day-to-day basis, at least after 15, I recommend a sunscreen on a regular basis. And there are now good moisturizing sunscreens also available. So again, based on your skin type, if you have a dry skin, you can use a little moisturizing sunscreen. If you have an oily skin, you can go for those matte finish or silicone based sunscreens. So only the basic moisturizer and sunscreen are also very well enough unless you have any pathology. Like if you have acne or you have some pigment issues, you can definitely approach an expert and then follow accordingly, rather than buying too many products, trying out multiple things, getting vexed, and then stopping everything. This is something which is happening. They're getting vexed and then they stop using everything, including the sun. So minimal
Right.
skincare, as you said, the one which has to be adopted. Let's keep it very simple.
Right. So it should be simple, minimalistic, and we can be more consistent with it. Because as you said, Dr. Yeah, these days, Korean skincare regime or 10-step skincare routine is there. And it's so, not practical to follow them on a routine basis. So yeah, these simple yet effective things can lead you to a healthier skin. Now, doctor, many times we see various patterns, like we see, small bumps on our forehead or acne in the butterfly area, cheeks, nose, etc. Then we see these, acne alongside the jawline. Do they tell us something?
They do. They do. The place where you're having acne do give us some clues. So if you're having too many forehead acne, you have to watch for the oil secretions of your scalp also. And some teenagers, they have a habit of covering the hair with the, covering the
Right.
forehead with their hair. So
Um,
knowingly or unknowingly, it leads to that sebum pooling over there, and they might have. So forehead acne, you have to look at health. Okay, and acne, especially on the jawline around the chin, you have to look into the hormonal issues also. So for especially women who are having this PCOS, or adult women also who are going through some hormonal changes, we watch for acne in the lower part of their face. So they have the cystic and painful acne in the lower part of the face. And especially when you're looking at your sides, no, then you have to rule out all the frictional causes. So you're sleeping only on one side, you place your hand, you use your phone. So all these, again, this frictional cause on the sides. Uh, there is actually one more thing also. People know, if people have a habit of sitting like this or sitting like this, watching TV or phone, sitting, have this kind of, sandpaper kind of skin in the lower part of the faces. We call it as acidic folliculitis. So friction definitely triggers oil gland issues. So you have to try to minimize and keep your things, whatever you are using, clean in order to avoid.
yeah. Your hygiene, the products that you are using or that are very close to your face needs to be hygienic as well, like your mobile phones, pillowcase, etc. Doctor, because we just spoke about the skincare routine, and as you said, a cleanser, moisturizer, sunscreen is very important. But there are so many myths associated with these, things. For example, those who have an oily skin or acne-prone skin, they tend to wash their face n number of times, feeling that if they'll keep on, washing your face, it will keep their face dry or dirt-free, thus acne-free. Is it right?
It is not always right. Yes, definitely. If you have too much of oil pooling, we say to wash at least twice a day, or you can add, cleansers in such a way that it cleans your oil. Okay, very mild too. You can add a salicylic acid cleanser which cleans your oil better. But what happens is, the myth is, when you wash it too many times, no, your skin tends to become dry every time you wash. And what your oil glands will think is that they try to compensate by producing more oil. So the way they function, no, they again can lead to acne. So you have to maintain that balance. So your skin barrier should be maintained. That balance should be maintained. It should not be too dry, because if it is too dry, your glands will think they have to function and then they cause acne. If it is too oily, again there is a lot of chance for clogging and acne. So the balance is always important. So if you feel it is too oily today, you can wash an extra time. There's no harm in that. But you have to keep that, not make it too dry or just make it so dry that it peels, and again you're. So there are this combination skins where people have excess dry skin but still a lot of breakouts. So the barrier, if
Right.
maintained, it will help.
Absolutely. And again, with moisturizer, people say that, I'm already secreting so much of serum, I have an oily face. Why do I need to use moisturizer? And probably this is the reason many times, oily face people, oily skin people avoid using moisturizers.
Hmm. No, thankfully there are now beautiful formulations of moisturizers. Earlier, I might not have, maybe 10 years back, we have told us that no, you have to use a moisturizer even you have oily skin. But now we can tell it because the moisturizer formulations have been, they're very well formulated. So they're most of them are non-comedogenic, no, acne-friendly moisturizers are there, and they are so lightweight that they only hydrate your skin. They are not going to add oil onto your skin. So it's a myth that oily skin people should not use a moisturizer. You only have to pick that moisturizer which is, suiting your skin. So a very lightweight or based moisturizer will actually help in, keeping your barrier healthy.
Fair enough. And again, with sunscreens, people have so many complaints or excuses for not using sunscreen on a regular basis. They feel that we need sunscreen only when we are going out under the sun, or especially people who have oily or acne-prone skin, they will say that we don't want to layer up our, already acne with a layer of sunscreens. They don't like the dull, patchy feel that they get, etc., etc. So, what is the right kind or type of sunscreens that we should go for in case we have a oily or acne-prone skin, doctor?
Yeah, if you have an oily skin, you have to remember that whenever you are using any acne treatment in the night, suppose the doctor recommends you retinoids or adapalene base, your skin is tend to become more sensitive. So the usage of sunscreen is also equally important. Okay, it is not like just your acne creams are going to fix the issue, because if you're not using a sunscreen properly, again it might lead to too many pigment issues in later. So oily usually can try out sunscreens gel based or with silicone based. They usually like they can also try this matte finishing sunscreens also. But to be frank, it's a very personalized choice, because when I see two oily patients and I recommend one, aqueous water-based sunscreen, one person will like that more compared to the matte finishing sunscreen. One person will say that aqueous is not good, matte one is only good. It's a very personal choice, but ultimately what you have to look at is a sunscreen which is maybe physical sunscreens are too greasy. So rather than that, they opt for this mild gel-based and lightweight sunscreens. Thankfully, there are beautiful formulations available now. Definitely, one of them they will like. You try one or two, definitely you like. You can continue.
And it's always a good idea. If you are confused what to go for, what will suit you, what is your skin type, please go and consult with your dermat. They'll help you in choosing the right product because they know your skin. And again, as you also said initially, doctor, market is flooded with products. Then we have so many influencers on various social media platforms, and they all are endorsing various products. So there's so much of marketing gimmick, and we fall for it. So I think, and I would like to ask you, is it a good way to go and consult with your skin expert that what we should go for, and then they can suggest as per your skin type, etc.
If you ask me, I will say that should be the only way. Okay. Because
Okay.
following these influencers or trying out the products they are recommending or the market ads are recommending, it's just no, you're just playing with your skin. You have to consider your skin is also an important organ. You should not take it for granted. Okay, you can't experiment too much and then spoil it. Use of those steroid creams which a pharmacist gives or which a beauty parlor auntie gives, and then ruin it completely. And then repenting at that stage is not recommended. At least in this age, after so much of awareness, everybody are educated. Everybody has information through various platforms. We should not fall for whatever they say, but we should be wise enough to choose what is best for us.
Right. And as you said, we need to understand that what to go for, what to not fall for, etc., etc. Another very important part that I would like to discuss with you, doctor, is about over-the-counter topical application, over-the-counter medication, etc. This is so common, especially with acne, cases. it's so easily approachable. First, we have these home remedies, so we'll start applying whatever we get inside our kitchen or our kitchen garden, or will our friend or family member will suggest something, and we'll keep on applying, starting from multani mitti to basil to curd to garlic to lemon juice, etc. Then, if that doesn't work, then we go and consult a chemist shop that we are getting these breakouts, please suggest something, and we fall for that cream because initially that whatever topical application tube they give, initially they work wonderfully. We feel like, oh, we have saved the consultation fees of a doctor and got a magic cream in our hands. But then later on we all understand also that now our skin is addicted to that particular tube. So my question is, do these home remedies, over-the-counter topical application, etc., they really work or they harm us more?
No. In my opinion, they always harm us more rather than what they work. Okay, there are some, as you have listed, most of them are harmful. Whatever you are told, so they will lead. All these home remedies will lead to irritant contact dermatitis, and definitely they have to approach a dermatologist to get rid of it. Otherwise, it's going to, almost I've seen patients who have caustic burns while applying this lemon, garlic, baking soda, what not they have tried. Okay, caustic, they are traumatized with that pigment. It's difficult for the doctor also to address, when you face those things. We can't completely vanish things. Things can't be undone. Okay, at least regarding your scars. And secondly, these steroid cream ka issues have been, what we were thinking is, as the public are getting more aware of things, I think we thought that the usage of these over-the-counter steroid creams will come down. But into practice, I keep seeing them. I don't know what awareness is going on, but they're still raising. They're still raising. People are still trying them, and they're feeling good, and they're using it for a couple of months. And then once everything is gone wrong, they are going to come and visit the dermatologist. And then see, then that visits are going to be more, because initially that one consultation fee they saved, no, it's not going to work that way. And
Right.
have to do multiple procedures, work on them. That skin addiction part also, no, for it to be addicted from that steroid cream only, it will become 1 or 2 months to go off. And then we have to start working on the other issues. And sometimes there might be even a permanent pigment issues also. There can be hypertrichosis, that is hair growth, there can be thinning of skin. You see blood vessels directly visible and stretch marks. There are a lot of complications which, relatively they are long term. They are very, it's like a nuisance, treating them also, because all, infected by us only. It's not something which is happening from
So initially, when I said that go and consult a skin expert, a qualified dermat as soon as you spot these acne, it becomes even more important because if you go to the doctor in the first place, they'll treat your issue, and your issue is acne, whatever grade it is. The issue is acne. But when you go for these home remedies, over the counter topical applications, medications, etc., and then land up in front of a doctor, eventually you will have to go and land up in front of a doctor. But then the doctor, acne is, I mean, one issue definitely, but then there are so many other issues. It will definitely lengthen your treatment, procedure, etc., etc. So please don't complicate your symptoms, your problems. Just go and consult a doctor as soon as you spot acne on your skin. Now, doctor, now talking about the lifestyle thing, people say that eating healthy is good, sleeping, doing exercises. We all know it's good for our skin too. But then, what kind of dietary precaution you would like to recommend, especially in concern, in association with acne? Because many times we hear people saying you must have eaten so much of sweets, or maybe your dairy content is more. That's why you're having these breakouts. So, what's your take on that?
Yeah. If I have to admit that, our diet has become, too much of westernized. Okay.
Hmm.
Uh, is always more inflammatory, and it leads to more acne. The more Mediterranean diet back to whole fruits, vegetables, All these are going to help because they are rich in antioxidants. They are not inflammatory at least. They are going to help in that way. And a lot of dairy products, sugar, cheese, butter, ghee, all these are pro-inflammatory foods. So they definitely increase the risk of acne. So if you observe even our elder generations also, they never had so much of acne problems. Okay, what they have not done anything different from us. They are also in our country only. Everything, the lifestyle and all is same. But the Western culture we are adapting, the more Western food we are consuming, I think the incidence is becoming more. So instead of those processed foods, instead of eating all the breads or sugars, I think we have to cut down on stuff. Then go back to the earlier, a basic curd is good. Even in the dairy also, you can just go back to the proper Indian or Mediterranean diet. That is going to help.
Right. I'm getting so many questions by our users. One of the very common question people often ask is regarding makeup with acne. So if a person have acne, can they go for makeup? And many times it's not just about a choice; it's also about a professional necessity. So what to do there?
No, you can definitely go for makeup. Nowadays, there are lovely things which also act like your primer. So you can just apply your primer, then go for your try to use a very good products and lightweight products. Don't apply too many layers. Just try to take that one product which properly works, which properly conceals. So you can definitely go for makeup. Use a good sunscreen as a primer, and then add things on top of it.
Right. And cleaning the makeup. I mean, how to clean our makeup well so that it doesn't clog our pores. And what is the meaning of double cleansing?
Hmm. Yeah, basically, when you apply, too many layers on your skin, double cleansing is nothing but we used to do double cleansing earlier also, but now that term has become a
Hmm.
little popular. So you just try to clean with
Hmm.
any oil base, clean makeup with an oil base. It can be a simple moisturizer which you're using also. And after that, cleanse and wash with the liquid soap. That's itself is enough to clean your makeup. And there are a lot of
Hmm.
so if you want to, if you feel your skin is very sensitive and washing too many times, you can use those, this micellar waters and all over the counter which are available. You can definitely use them.
Right. And we also need to take care of our makeup applicators or brushes, right? Because they can also trigger acne, right,
Yes,
doctor?
yes. You have to clean them regularly in regular intervals at least.
Okay. Now, doctor, when a patient comes to you with acne, how do you diagnose? Are there various tests that you recommend for proper diagnosis and understanding the root cause, or just by taking the history, clinical investigation, etc., you're sure that this is the reason, probably?
See, acne itself is a clinical diagnosis, okay. But if I feel that depending on the patient, based on the age of the patient and other issues, you see unwanted, you see a pattern thinning and all, then I go for a hormonal evaluation. Otherwise, uh, there are some good of topicals which we can manage acne. Only when I feel it is more into hormonal or they have still a grade 3, grade 4 acne, then I intervene.
Okay. And what are the various treatment options that you have for acne management?
Okay, right from these applications, topical applications, we have some range of oral options also. Okay, and acne management is not complete unless we discuss about the scars and pigments. So the oral medication, and we try to control the active acne first, and then we add on, we go ahead and start treating the pigment, secondary to acne, and later we even plan, what to do with the scars also based on the, intensity of scarring. So for scars, again, we have a wide array of options because medical management hardly helps. We have to think about, lasers, fractional resurfacing, carbon dioxide laser. We have microneedling, RF. So and we do subcision base. We do TCA cross based on the type of scarring. Okay, and based on the feasibility. the patient can come in, and a lot of other factors also play. And we have to plan and then execute.
Right. And for post-acne inflammatory marks or scars, do medication works or they are just the procedures that help take care of these marks and scars, doctor?
For the spots or marks, definitely medication to some extent they will help. But for scars, we have to go ahead with the plan procedures only, because no amount of medical treatment will help for the scars. That's the reason we encourage to treat the acne aggressively even before the scarring happens.
What are the various procedures, doctor, for these scars?
As I have told you earlier, there are some basic, treatments like chemical peels. We apply, there is something called as TCA cross. Then there is something called as micro needling RF. Okay. MNRF, we say micro needling radio frequency techniques. Then there are fractional resurfacing or CO2 laser resurfacing techniques. We also, combine other mesotherapies along with this. There is something called as subcision also, and there are some quick fixes also based on the need. So there are a lot of options which we have to plan based on how what intensity of scarring you are looking at.
Right. Again, with the treatment or the medication management of acne, what people normally do, for example, I'm your patient, you have prescribed me medication for say 2 months. I'll follow the prescription for 15, 20 days, maybe 30 days. And because I can see the difference now, I'll say that, okay, now I'm fine. Why to follow and, pop up more pills? I'll stop the medication all by myself without keeping the doctor in the loop. I won't even inform the doctor. Now, again, in case I see outbreaks, because I have the prescription, I can go get the medicine and start it all over again. This is a very common practice, and I'm sure you also get patients like that. So, what's your advice on that?
So if I have to start oral medication, I'll counsel my patients they have to be informed. Okay? Creams are something I tell them you can use inevitably or on and off. It is going to be. But regarding oral medication, I warn them before only that there are certain investigations also. We keep monitoring how you're doing with the medication. So I try to keep them. If you counsel them prior, no, at least they'll be clear enough and they'll tell you that I can't be in regular follow-up. Don't give me those. So in those cases, I try not to, start oral medication also. I first see them if they are, in regular follow-up, because there are certain things to look into and we can't inadvertently, make them continue.
And what is a maintenance therapy, doctor? Is it equally important for an acne patient?
No, it is equally important, because whatever medication we are suggesting now, whatever oral options we have also, there are anti-inflammatory options which will help them. For the time they are taking the medicines, definitely they are going to help them. But afterwards, after the medication is over, also there are some topicals which they can still keep continue, because maintenance is equally important. Our skin is not going to change. We are not removing the oil glands now in this treatment. We are only calming them. There is always a fair chance that it can, go back to how it was if you just stop everything and then, you go back to your regular lifestyle. So it is all maintenance is always important. Your diet is important, your stress levels, your sleep habits, your physical activity, along with them, how you're maintaining at least the previous topical the doctor has given, you have to keep using them on. All of this is important. And anything regarding skin and hair consistency is something which is using them for a long period or making it like a routine is more important than getting new treatments every time.
Right. Absolutely. There's one question by Kiran. Are there any foods that can help clear acne or maintain a good skin health?
And definitely, as I told, these whole vegetables or fruits, okay, green leafy vegetables, dry fruits, all these to some extent they are helpful because they are all antioxidants. So all these they can, reducing the inflammation at least.
Okay. Shivam is here. His question is, can acne be hereditary?
Yeah, it can be. Acne, most of the times it's see a father having, bad scarring and, grade 4 acne, then
Hmm.
also has that amount of scarring. So I try to
Hmm.
treat them at the start. It is definitely hereditary.
Hmm.
Parent usually has a history.
Okay. Mhm. A very common obsession with those who have acne is to pop out the acne. I mean, we just can't keep our hands and fingers away from the acne or our face, which we all know is not a good thing. Any advice on that, doctor? How bad can it go?
Yeah, it can go bad. There is actually one condition called as acne excoriate, where they have this compulsion of popping up the acne. So if you see the amount of pigmentation this acne excoriate patients have compared to the regular acne cases, that's huge. Basically, they have a literally like a black chopped out rim kind of thing. So that itself is indicating that for people who pop out the acne, the pigment complications are going to be worse. So if popping
So,
out, getting more inflammation, and the tendency of having more pigment is definitely higher.
so keep your hands, your fingers, your nails, everything away from your face. Okay. Now, doctor, before we sum up, before we wind up the session, any take-home message, any do's and don'ts for our viewers?
Okay, at least now all our dermatologists are giving only one take-home message. You at least visit a proper dermatologist for all your skin and hair concerns. Please fall prey to influencers or the marketing strategies or your neighboring auntie ka suggestion or beauty parlor auntie ka suggestion. Please visit at least so many years of study your skin and hair, you have to consider them worth treating your skin and hair, not all these.
Like, when we have issues with any other organ, be it our kidney, our liver, our heart, we'll never go and ask our neighborhood auntie or our parlor wali auntie or a chemist shop wale bhaiya. We'll go and consult the right person, which is the, specialized doctor of that particular organ, whatever. But with skin, I think we are more lenient, but that should not be the case. In case you have any issue, please go to the right person, which is a qualified dermatologist, board certified dermatologist. Thank you so very much, Dr. Radha. It was wonderful talking to you. And I'm sure whatever information you have shared with us is going to help us understanding acne management and maintaining a good skin. Thank you so very much once again.
It was nice talking to you. Questions were really beautiful. They are like something which everybody needs to felt. Yeah.
Mm, right. Thank you very much, Doctor, for that. Thank you. Have a great day ahead, viewers. Thank you for your active participation. Have a great evening ahead. Take care of your health. Take care of your skin. Goodbye.